Hi there, and welcome to another podcast from WeTalkScience.com. Today, I have the distinct pleasure of interviewing Uduak Okoma. Uduak is a early career researcher in Gambia, and she recently won the OWSD Elsevier Foundation Award for Early Career Women Scientists in the Developing World. Welcome, Uduak, to the show.
Hi, Shiva. Thank you for having me on the show. I'm Uduak Okomo, and I'm a pediatrician and an epidemiologist working at the Medical Research Council Unit, the Gambia, at the London School of Hygiene and Tropical Medicine. Quite a mouthful. The institution I work in the Gambia is a research institution called, used to be known as the Medical Research Council Unit, the Gambia. And last year we were formally integrated into the London School of Hygiene and Tropical Medicine. So we have this very, very long name, which is quite a mouthful to pronounce. That being said, I'm Nigerian by birth, but I've lived and worked in the Gambia for the last 15 years. I'm a pediatrician. I had my medical training in Nigeria, and I started work as a pediatric trainee in Nigeria and completed my training also in the Gambia when I moved in 2004. I also have a master's degree and a PhD in epidemiology, both from the London School of Hygiene and Tropical Medicine. So I love children. I love working with children as a pediatrician. Growing up, I had a very lovely childhood. I come from a very close-knit family, and I was always assured and aware of my parents' love, and they tried to make sure that my siblings and we had the best possible childhood. And so I felt drawn to pediatrics when I'd see children sick in the hospital and, looking so helpless, and I'd see mothers bringing their children, with that look of desperation in their eyes, wanting their child to be better. And I remembered all the times that, my parents would fuss over me if I was ill or I had a cut or I had a fever or something. And it just felt good to be able to work with these mothers, work with their children, treat the children, and, the mothers go home with a healthy child, which unfortunately isn't always the case. But as much as possible, we do our best within the circumstances that we find ourselves. And so, yeah, being a pediatrician is really something I love doing. And I was also very inquisitive as a child, so I was always asking questions and wanting to know why. And my parents encouraged us. And so it wasn't just sufficient to know the answer to a question or something, but if it's possible, try and find out the deeper meaning or things behind it, reasons behind it. And so as a doctor too, I'd always want to find out more about illnesses or why certain people came down with certain illnesses and others didn't. And very early on in my training as a pediatric resident, I was fortunate to be mentored by a senior colleague who was also a researcher. And so he introduced me into clinical research. And when there was an opportunity to work in a research institution, outside Nigeria, I didn't really hesitate, and he encouraged me to come. And so moving to the Gambia was a career and life choice for me, and it was really interesting. I started off working in the clinical services department as a pediatrician, continuing with my pediatric training, but I had opportunities to set up clinical trials looking at improved ways of treating malaria in children. And then from there, I worked on severe malnutrition in children. I worked on severe pneumonia in children. I worked with pediatric HIV. And at that time, I was the only pediatric HIV specialist in the Gambia. And so I had a large cohort of children that I was looking after. I also worked as a consultant in the teaching hospital in the Gambia, managing a wide range of illnesses, pneumonia, malaria, meningitis, malnutrition, what have you. And while I was doing this, as I mentioned before, I was able to do a master's degree by distance learning with the London School of Hygiene and Tropical Medicine, and yeah, I was happy, being able to combine research with clinical work and also being a lecturer teaching pediatrics at the University of the Gambia. And there was an opportunity for me to do a PhD, and neonatal mortality. So that's a neonate is a newborn less than 28 days of age, postnatal age. And neonatal mortality was a big deal in the hospital I was working in the Gambia at that time. That's the teaching hospital. And when we'd have our handover meetings in the morning, we would find out that maybe six or five or eight, any number of babies could have been admitted the night before, but by morning, about half of those babies would have died. And we didn't really know why the babies were dying. We were limited in our diagnostic facilities. And so that led me to try and look at the records in the over a 5-year period to see what the mortality trends were, what the causes of admissions and causes of death were in the neonatal ward. And what was shocking was about, 1/3 of all babies who were admitted into the newborn unit would die or each year over a period of 5 years that we looked at that time. And infections, prematurity, difficulty in breathing were major causes of admissions and death. And it was also shocking that the babies were almost all of them were getting antibiotics at admissions. About, over 90%, 95% of babies admitted received antibiotics, but less than 5% were investigated for, an infection, which was really, really shocking. And so this is really what informed what I did for my PhD. And I looked at neonatal infections in that hospital and other hospitals where babies were admitted in the Gambia. And through the funding for the PhD, I was able to carry out basic investigations for these babies, such as blood culture. And we were able to find out what the major causes of infection were among these babies and were able to provide treatment for them. And now, as a postdoctoral research fellow, I'm looking more into how these babies get the infection. So, what was interesting also during the PhD was that there were outbreaks in the neonatal ward, and so babies were getting infected with um, organisms that were in the hospital environment, and these were not from their mothers. And when we did further investigations, we realized that the antibiotics and the fluids that we were giving the babies were contaminated. So they weren't contaminated from the suppliers, but in trying to make them up on the ward for the babies, they became contaminated. So my current work really now is to understand the transmission of infection in the newborn, whether the infection is coming from the hospital. So what are the sources in the hospital where these babies are picking up these bugs? And then that's going to inform infection control policies in the hospital. Another thing I'm interested in is stillbirth. So, a stillbirth, so a lot of women, go into pregnancy and not all of I mean women go into pregnancy, but not all of them would deliver a live baby. And so you have what you call the macerated stillbirth, and that means that at some point the baby stopped kicking and died for a while in the womb, and the mother delivered it late, realized this much later. And then you also have what is called the fresh stillbirth, whereby a woman goes to the hospital in labor with a baby that's alive and kicking, but by the time the baby is delivered, the baby has died. And so this is a burden in many developing countries, especially in sub-Saharan Africa. And I'm also interested really in trying to find out, you know, um, just how large a problem this is and what the causes in our own context are and what we can do to prevent this, because stillbirths are preventable, largely preventable with um, proper antenatal care and care during labor. And so that's really in a nutshell what I'm doing now.
Wow, that's absolutely brilliant. Let's go back to the infections that babies seem to take up in the hospital. What were
Yes.
the major causes of deaths there? What are the major causes of infant mortality in these hospitals in Gambia?
Okay, so infections are one. Also, babies that are born premature, preterm, and are low birth weight, and so they have problems adjusting as a complications of their prematurity. And there's also something called birth asphyxia. And so, if the mother had a difficult labor and oxygen supply to the baby was kind of like compromised, and so such babies are born and they don't cry initially at birth, or they have a very, very weak cry and they struggle to adapt to life outside the womb. And so complications from that process too also resulted in death in these babies.
Okay. What about, well, how big of a problem is antibiotic resistant organisms in the Gambian hospitals?
Okay, so in most of the Gambian hospitals, investigations to determine what a cause of infection are. So the blood culture is the standard for a blood infection or sepsis, and a lumbar puncture is a standard for suspected meningitis. And so one collects once one collects these fluids, then they would have to be sent to a laboratory for processing, and that's what we call culture. And we now determine the antibiotics that would be appropriate for the organism, and that's what's called sensitivity. And so when one gets the results back, one would actually see if the antibiotic that is being used is the appropriate one to treat the pathogen or the organism that was isolated. And so these investigations are not widely done in government hospitals in the Gambia. The research institution where I work is able to provide this, but we can't provide it to all patients in the country. So we could do it for the small number of patients that are admitted in our facility, but in the teaching hospital, that's very a different setting, and we're not able to provide that service routinely. And so the data on antibiotic resistance generally from the country is very, very limited. But looking back at my study, we did find some organisms that were very, very resistant to not just the first line antibiotics that are recommended by the World Health Organization, but also the second line antibiotics. And so that is a cause of concern. But even then, this was just a small number in terms of the compared to the larger population of babies.
I see.
Yeah.
So you work with mothers and babies. I mean, as a woman, as any human being, that must be fairly emotionally draining for
Um,
you.
Yes, I think it is. As frontline health professionals, working with sick patients is emotionally draining because these are people that you have sat down with and you take a history. So in medical terms, we say you take a history. So a patient presents to you and you're going to ask them some questions. So the questions will help you, formulate what is wrong with the patient. And in the case of a child, a very young child that's not able to communicate, then of course the mother, is the one providing the information. And so you'd have to probe and to find out, a bit more about their personal lives and circumstances. And this really information helps you to arrive at your diagnosis as well as an examination of the patient. And so you get to hear a lot about people's personal lives, their social circumstances, and you sometimes you really find that people are going through quite a lot. They're struggling with very, very poor socioeconomic circumstances and living conditions, and even just sometimes just the ability to feed and access to care, and then they struggle to come to the hospital. And it's difficult sometimes when one is working, especially in a very resource limited setting, whereby patients have to pay for some things out of pocket. And so these are people that are struggling to survive, and then to have the funds to also pay for healthcare is a problem. And so yes, it's emotionally draining at times. And I know there are times well, this was back in Nigeria. I've had to donate blood for patients. there was a child I remember I was treating, and the child had a form of cancer and was on chemotherapy, and this depletes the blood cells for the patient, and so the patient needed blood transfusion. So the parents had given, both parents had donated, and the child still needed blood, and they couldn't get a donor, they couldn't pay for a donor, and I just was happy, so happy to donate blood for that child. And so that had happened on a couple of times, and sometimes you have patients that caregivers are struggling to eat, and you can give them something to help contribute towards their stay in the hospital. But it's emotionally draining. I've lost patients that you've put in everything you can, and you've consulted with colleagues, and so many people have reviewed the baby, and despite your best efforts, the patient dies. And I've cried over patients before, so yes, it is emotionally draining. But when for the ones that you're able to help, and they get better and they go home, just the smile and on the parent's face, and the relief and the joy is rewarding. It is.
Can I just say I have nothing but respect and so much admiration for you. This is absolutely amazing work that you're doing. So, looking back and looking forward, what would be? So, can you tell me one thing or a few things that you want to see in hospitals in your country? Because I have personally, I've never been to Africa and I've never
Mhm.
experienced that environment. So, what do you feel that the hospitals in Gambia, especially the hospital that you work in, I'm sorry,
Mhm.
would benefit from?
That's a very interesting question, and I wish someone just gave me, a blank check and there's so many things. Because I mean, I think one of the major problems, and a lot of hospitals, and not just in the Gambia but across the developing world, faces personnel, having sufficient numbers of trained healthcare workers, and being able to sustain, to keep them, to retain them. So where you have wages are poor, there's a high turnover of staff, leaving for greener pastures, either outside the country or moving from the healthcare system to some other, sector where they can, you know, earn sufficiently to live decent lives and train their children. And so there is a shortage of qualified staff. So staff are overburdened, staff are overworked. And so that's important towards making sure that there's good quality of care. Quality of care is not just related to the staff, but you need staff that are able to provide those care. And if staff are overworked, and then that's going to affect the quality of care. I had done an audit of newborn care in the hospital I was working, and of course we had very few nurses. We had just one neonatologist in the unit, and we found out that mortality among the babies was highest, when over the weekends and during the night shift, when you had less qualified and able staff on duty. So that's one thing. And then, of course, being able to have proper equipment in the hospital, sometimes even just basic things like suction machines, having running water. So the hospital I work, the newborn unit is upstairs, and um, there is a problem with the plumbing, and so the taps don't flow, and we have buckets, with water and a jug to scoop water, and that is a very, very, very good way to spread infection because
Yeah.
of course if your hands are not clean and you pick up the jug to get water and all of that. So more infrastructure. I think hospitals also need to be planned well. So the hospital, again, in where the teaching hospital, so it's different from the research center where I work, but the teaching hospital where I did my research work, um hospitals need to be planned properly. And so the maternity unit, the where the women are admitted in labor, and where they have their babies, and where the women are admitted after delivery, is in a completely different wing of the hospital, which is separated by a major road. And so the newborn unit is in a different wing. And so being able to move babies from that place, from the maternity to the newborn unit, is a problem. we found out that a lot of these babies, by the time they arrived at the newborn unit, they were cold, very, very cold. And a cold baby could, so many problems and complications could develop from there. And, when they're planning the unit, the newborn unit should be next to the maternity. So it's even easier for the mother, a woman who's just recovering from a cesarean section, to walk a few meters to the next room or wing of the hospital just next door to see her baby than having to walk out of the hospital across the road into another wing of the hospital and up a flight of steps and down a corridor to the neonatal ward. So there needs to be structure in our health facilities. And of course, as much as possible, even things like medications and other hospital equipment and consumables need to be readily available.
That's very, very well noted.
Yeah.
Okay, let's talk about the award that you won. So let me actually read off what this means. So this is an award that was given in combination with the Elsevier Foundation and the Organization for Women in Science for the Developing World, the OWSD. What do you hope to achieve with this award?
I don't think the word there's anything to achieve as such. It does give me a lot. It has given me a lot of visibility, and in many ways, my life has changed since I received the award and it was made official. But I think to answer your question about what I hope to achieve, I hope it um, raises the profile of women scientists in developing countries, and people get to see that we there are women who are achieving a lot in their field in as scientists, sometimes working in very, very difficult circumstances, but still passionate about what they do. And we can serve as role models for um, younger women and girls who are thinking of career in science, and as role models for them, and hopefully as mentors. I do mentor quite a lot of people, both male and female, and yes, it's just visibility and encouragement and hope, because it's easier when you've seen someone who has achieved some measure of success in an area that you're dreaming of, and it makes you realize that it's possible to achieve your dreams once you have a role model to look up to. So yeah.
Uduak, one more question. What advice would you give to a young student who wants to follow in your footsteps?
I would say be passionate about what it is you want to do. It's your passion that would wake you up in the morning, even when your body tells you you'd rather stay in bed. And be prepared to work hard. I mean, in every sphere of life, one really needs to work hard, but science also is really hard work. You need to be up to date with advances in your field, and so it requires a lot of studying, a lot of reading, a lot of interaction with colleagues. But if it excites you, if it intrigues you, if you're passionate about it, you don't really see it as a labor. And yeah, and try to piece of advice I'd like to give people is to get mentors very early in life. And I think my mentors have really helped me. I have quite a lot of mentors. I've had mentors from as early as possible. Some of them are still mentors today. Some mentored me for a certain period in my life, and I still appreciate their input. So one needs mentors. They don't have to be so far off across the world. Start with your environment. So I had mentors even in my department from my teachers, people who I admired, and I learned something from them. And in through their interactions or my interactions with people, I was able to get other mentors. And so, yeah, that's what I'd like to tell a young aspiring scientist.
Well, I
And
have
then
to.
don't be afraid to dream big and dream wide. Yeah, your ideas may be crazy at that moment to everybody else, but it's the same thing with people who dared to dream differently and say that the world was round when everybody thought it was flat. So they were laughed at the beginning, but today we all know that the world is round. So, yeah.
Well, I have to say, you have inspired me. Thank you so very much for your time. And I really look forward to seeing what you do next because I think that you're working in an amazing place against all odds. Thank you for your time, Uduak. I really appreciate it.
Thank you for having me.
And to everybody else who's listening to We Talk Science, if you like what you're hearing, let me know. And till the next time, thank you very much.